Good morning, everyone. Hi, my name's David Solomon. I'm David Solomon Jr. I'm a senior lecturer in the University of Bedfordshire. I also have a lot of experience working drugs and alcohol. I work currently in one provider in the community at the moment, and I'm also a student at Anglo-Ruskin University too. So I understand you're in Auckland University, so I'm just going to do a little overview in terms of some of the drugs that you may come across, when you're in practice, and particularly mental health. So my research at the moment surrounds how health professionals experience, view, and respond towards users of new psychoactive substances. So these used to be called legal highs, and as you know, no longer legal. Particularly in New Zealand, there's a blanket ban, as you may already know, in terms of outlawing these drugs. Slightly different in the UK. Some are still quite easily available for catering purposes or manufactural purposes too, but some of these drugs still get misused, even though they do come under the new Psychoactive Substance Act in the UK from 2016. Nitrous oxide or balloons or or just gas, quite simply, is quite popular. Okay, so why people use alcohol and drugs? It's mainly to deal and try and deal with the symptoms of their mental health problems. Also to self-medicate, and also quite simply as a coping mechanism, as you probably already know. And sometimes the symptoms can get a lot worse, particularly if you have a severe mental health problem, or if you're quite young, if you're in a young age range, early 20s, for instance, or in your teens, or if you're above 40 years old, it's quite common for someone to be unwell and to get worse in terms of the mental health. They're drinking and taking drugs, and some drugs, more can cause mental health problems too, as you can probably see on the PowerPoint that I've sent you. So new psychoactive substance, so NPS or legal highs, or as you can see on the picture on the PowerPoint, fake pot, which fake pot causes real problems, or fake cannabis, or what you would call synthetic cannabis. So these are drugs that aren't natural. They're not. They are designed drugs, particularly made for misuse, and they are aligned and developed in terms of the same ways and structures, and just slightly tweaked of illegal drugs, for instance, like cannabis and so forth. But they come under different categories. Lots of different research saying different types of categories are available, but I like to just put them down quite simply as stimulants, downers, psychedelics, hallucinogens. Okay, and as you can see, I've uploaded a category, which I did with the Nursing Times and with a consultant from North London, Bernadette Solomon too, who works in the University of Auckland too. And you can see on the chart here, so stimulant drugs. So I've given some examples of some street names or some trade names that are easily available. So methadone seems to be quite popular. Even in the UK, methadrone's particularly common in cities, for instance. The drug's been banned for a good decade now, but it's still easily available. It's quite misused in the MSM community, or the men who have sex with men community, or what you would call chemsex. So there's someone who's founded the term chemsex and does a lot of blogs on YouTube too, called David Stewart. He has a lot of insight in terms of what happens, and he runs a clinic too in London too. You can see here methadone, benzofury, party powders, and legal ecstasy and so forth under stimulants. So, for instance, methadone is fairly similar to cocaine. But in terms of usage, I think some people they can use for hours and hours and hours and hours. So it's very, very similar, but the structure of the drug, the molecules of the drug are very, very different, just slightly tweaked, as you would say. Hence the term legal highs, or NPS now. So, just like when someone's using cocaine, energy levels going to be very high. You're going to feel euphoric. You're going to feel quite good. That's why people are taking it. Your thoughts might be quite rapid, but also, you'll have negative effects too, which are quite common. So, for instance, paranoia, feeling anxious, confusion, psychosis. So, hearing voices, seeing things that aren't there, paranoia, um, heart rate as well can be increased too, as well as the immune and nervous system. So there are quite a few negative effects, and also if you could look on the UK website called Frank as well, which is very, very popular in the UK to help identify which drugs which is a very good identifier. And as you can see in the second category on the PowerPoint that I've given you, you've got sedative and depressant or down illegal highs, okay, or NPS I'd rather call them. Okay, so drugs like benzodiazepine, for instance, they work very, very similar. So if you're using benzodiazepines, usually if you're prescribed it's for short term, and it's very, very good for anxiety. It's very good to make someone feel quite sedated, reduce inhibitions, feel euphoric and quite relaxed. They're used as muscle relaxants as well. So you could probably see a whole list of the different trade names here, or street, I would say, or slang names like TNT, Big Daddy, V8. So lots of different types of names out there on the street. Negative effects as well too. So confusion, panic, dissociative effects, so not being in sync with oneself, or sometimes just having perhaps like out of fit, can cause unconsciousness, coma, and death as well. It's also quite common. Anxiety too. So these drugs, they have quite a sedatory effect. They make you feel quite relaxed, quite chilled, but they do have downers, and you can get withdrawal too. So just like diazepam, for instance, or midazolam, and if you use it for quite a long period of time, you're going to get withdrawal. You might feel agitated, you might feel aggressive, you might not feel yourself if you're misusing it. So that's why in the UK, most places in the world, they prescribe or give out benzos, for short-term effects because of the addiction, the probably addictive effects of the drug, okay, and it absorbs quite deeply into the tissues and the fats and so forth, okay. And you've got on the bottom category here, so I've joined them together, so psychedelic and hallucinogenic legal highs too, or NPS. So these are drugs a bit like magic mushrooms, for instance, so synthetic magic mushrooms. So they've got funny little names here like Space Trips, Bubble Bud, Druid's Fantasy, Space Cadets, and Salvia divinorum. And you've probably heard of spice as well, which is very, very common as well too. So, they can cause hallucinations, euphoria, you can feel quite warm and dissociative, meaning that dissociative effects that you might sometimes have an out-of-body experience, particularly like LSD, for instance, okay, or if you're tripping on LSD and you're using ketamine and all these sort of hallucinogenic and psychedelic sort of drugs. But it can also cause a lot of confusion, panic, and alter your perceptions, meaning that you might think certain things are real or unreal, and you might have quite strange views. So they're quite particularly dangerous. And in terms of spice, which is quite common, which is synthetic cannabis, meaning that it is not cannabis. It's a drug designed in labs that is not natural, and it's it works very, very similar to cannabis, but I think with the side effects of spice, something quite common is seizures, paranoia, aggression, and likewise with traditional illicit cannabis that you use on the street. The different types of strains. It's not, I wouldn't say it's a strain in terms of NPS, but they can make you quite paranoid. They can make you quite unwell mentally as well. It can cause psychosis. I know the research can be quite mixed, but a first-hand experience seeing people in practice, cannabis and mental health problems really don't go together. But then again, some people can smoke and they might be fine. So it depends really about how someone is how it reacts to them, I'd probably say, at the end of the day. Okay. And P, which, methamphetamine in New Zealand. I've seen it when I've been out there to visit my parents, and when I was on placement in New Zealand too, I saw the effects of P have effect on the community. But in the UK, it's used a lot in the city. It's used in chemsex environments, and methamphetamine is quite popular in cities. But I can understand it in New Zealand. There's lots of different names for the drug. I remember driving one time and seeing someone smoking away on meth, and it's very, very dangerous. I remember seeing people when I've been in New Zealand as a student, that had been blown up in labs that they've made in their cars or in their homes, and have lots of burns on them, which is quite dangerous. So I've put a few slang names here like ice, glass, crystal meth, crank, Tina, which is very, very popular. London, P or methamphetamine is commonly known as Tina. So that's something very, very common in cities. Okay, and you'll probably see I've put a diagram in terms of what it actually looks like. It looks like ice, to be honest. It looks like scrunched up ice cubes. So you probably work out on the diagram there. Okay, and you can use it in tablets, powder, crystals, and so forth. And how you take it, you swallow it, snort it, you can inject it. Smoking is more purer. Okay, and the high is quite intense. Okay, but you also need to be aware that people that inject certain drugs, they are at risk of bloodborne viruses as well. For instance, like hepatitis C, which requires treatment, and HIV too, which is also a risk. And the main risk is sharing equipment. So if you do come across people that are using these drugs, just to try and step away from being judgmental, and give clean work. So give clean syringes, give the appropriate syringes, give them steroids, give them swabs, and give them boxes, and citrus acid as well, if they are using, for instance, heroin and so forth. So you just want to make sure someone has clean works and can replace them as well, which is very, very important too. It can cause lots of different health problems as well. People that are injecting and so forth, like DVTs, blood clots, and which can be very, very dangerous to someone. And can cause amputations as well. So I used to go to the leg ulcer clinics for some people injecting in their groin, and if you hit the artery, that's not really a good sign as well. So people actually do inject into the artery and have a little hole in their leg too. But moving away from that, methamphetamine usually is smoked, as you probably know. Okay, and why people use P? To make you feel good, feel alert, feel awake. However, has the negative effects, a bit like the other ones I've just shown you, in terms of feeling agitated, paranoid, confused, aggressive, aroused, disinhibited. And the high can last between 4 and 12 hours, and the come down can be quite severe. Hence why there's lots of problems, and why people need to keep maintaining that balance when they are using. And and it can test positive for 1 to 4 days in urine drug analysis when it's being tested too. Okay, it's not too common in certain parts of England, but I have seen people positive in mid England, Hertfordshire, London. So I have seen that. So physical health risks I put on the PowerPoint here. So increased heart rate, so tachycardia, blood pressure as well, risk of heart attacks, which is quite worrying, higher dose, stroke, lung problems, kidney problems, gastro problems, coma, death, which is quite a concern too, brain damage, lowered libido, and and an increased libido, so meaning that some people might have unsafe sex. So also, again, so if you are dealing with people that are you on P, maybe you could offer them like contraception, female or male, condoms and so forth, or referral on to sexual health clinics, which is also a good way to ensure someone is safe and prevent unplanned pregnancies. You don't really want to be promoting, you don't really want someone to be, putting themselves at risk, get pregnant and they're on drugs, and the child's going to be surrounded by drugs and so forth, which isn't really ideal. So to help prevent further physical health risks, just try and promote contraception as well. And mental health. So that's quite common, as you probably know. You're studying mental health. Someone's using any form of illegal drug will have an effect on the mental health. So severe psychosis is quite common in P as well. So hearing voices, seeing things aren't there, losing touch with reality. And also there's a effect on the brain as well, so certain types of damage as well for longer use. And the drugs wheel, which is used in England. So this is for NPS, or new psychoactive substances. Okay, so that's what I'm studying, and I have supervisors guiding me all the way. So you can see here, I put in pathogens here. So it's a bit like ecstasy, MDMA, and so forth, and showing lots of different street names here, like 4-MPM, psychedelics like DMT. Okay, and 2C-bromofly, as you can see, they put it 2C-B-fly. Okay, so they're a bit like drugs that you get the out-of-body experiences and under LSD and so forth. And N-bomb as well, which is quite popular in New Zealand, for what I remember. Dissociatives, okay, so as I mentioned already, so ketamine, horse tranquilizers, PCP. There's another popular one there, so 3-MeO PCP. I've seen that one in practice before, someone using that. Salvia, nitrous oxide, so the little poppers, the nitrous oxide that you'll see in the canisters that people, get high using the balloons and so forth. So very dangerous as well, as you probably already know. Cannabinoids, okay, I'd probably say synthetic more than anything. So drugs like spice, which are very, very dangerous. What names are on here? So NM2201, cannabis, 5C, I've heard is quite dangerous too. Depressants, so other forms of drugs. So drugs like zopiclone, pregabalin, diazepam, as I've already mentioned, and street names called kava or solvents, and opioids. So opioids are like heroin, very addictive. So I prescribe methadone or buprenorphine, agonist, antagonist, to help people with the withdrawal and with opiate dependence or heroin dependence. So everyone that I see in practice, they don't all typically present as heroin addicts. It could be someone that's maybe had a bereavement or may have had an accident and has started to use large amounts of codeine and start to suffer with withdrawal and so forth, and might need some help. But typically in substance misuse, we don't always prescribe for pain. We usually refer onwards for pain. So we're dealing with addiction most of the time. So as you can see on the drug wheels, you can see drugs like methadone. That's the one I prescribe. Buprenorphine, tramadol as well. You can get that too quite easily. For the GP if you've had maybe an accident and so forth. Dihydrocodeine, which typically we wouldn't really prescribe that because it's quite addictive. Morphine, hospital, so if someone's been unwell, people can become addicted to morphine too. Kratom seems to be the most popular street name to what I know in drugs and alcohol. And stimulants, so as I mentioned, methadone, you've got cat. So cat's been around, you've got to remember, for about 1,000 years, over 1,000 years, and it's from the Eastern Somalia community. And when you're using cat, which is a stimulant a bit like cocaine, you're chewing the certain types of leaves and you're getting high. And just like cocaine, you feel euphoric, you feel alert, you feel good, you feel euphoric. There will be a come down where someone will feel really unwell, agitated, aggressive, paranoid, and so forth. So that's quite common too. Okay, so the drugs wheel is very, very, very popular. in drugs and alcohol settings. And how do you access them? So nowadays, when you're accessing drugs like NPS, new psychoactive substance, or tweaked drugs, or synthetic drugs as I like to call them, usually through the internet, and usually when you're buying these drugs, typically you'd go on a website called the Darknet, and you use a Tor browser, meaning the onion router, so it helps prevent detection of law enforcement and so forth. Hence, why it's easier to get these type of drugs. Okay, so these are sites that help scramble locations and so forth, so you can actually purchase these drugs, okay, online. And psychonauts. So you have people that use these drugs recreationally, and they write blogs freely online and talk about the experiences, the dangers, what to do and what not to do. And it can be quite a good forum to find out a little bit more about what's going on with that drug as well. So these are people what you would call psychonauts. So they're not doing anything legal. However, it can be beneficial to find out a little bit more about what's going on. Alcohol use. Okay, so alcohol is a legal drug, as you know, and it will have an effect on every single aspect of your body. So alcohol, in terms of misuse, can shrink your brain, cause blackouts, behavioral changes, personality changes, lung infections, cancer, fatigue, birth defects, infertility, liver damage, heart damage, dependence, and as you can see on the diagram, it can cause every problem known, as I can see physically. So in terms of moderation, if someone is using, I'd say, more than the recommended amount, which you should be drinking weekly in terms of men and women, which is usually about 14 units, then they can cause these problems. So ideally, men should not be drinking more than, I'd probably say, 3-4 units a day. Okay, so maybe a beer and a half or so a day. That's kind of the recommendation. But they seem to go up and down quite a lot of the time. But I think everything in moderation. I think that's important. If it's having some form of effect, then don't drink. Quite simply. Other risks. Violence, antisocial behaviour, unsafe sex, sexually transmitted disease, accidents to the A&E, long-term risks, as I mentioned, so, depression, dementia, liver cancer, liver disease, ascites, unemployment, homelessness, financial problems. So the list is endless in terms of misuse of alcohol. And when I've seen people in practice, when they are dependent, sometimes I observe them physically in terms of their body mass, how much they weigh, their height and BMI, and coloration of the eyes if they're jaundice, and that can show a breakdown in the liver. And also I check the stomach as well if it's distended. So if signs of ascites means that the liver isn't functioning the way it should be functioning, and measuring the liver as well. The liver is quite an amazing organ. It can regenerate, but however, it can only stand so much. And once you start getting cirrhosis, the effects are irreversible. Hence why some people need liver transplants and so forth. So the effects of alcohol misuse can be very horrendous. And typically when someone's withdrawing, they may be shaking, they'll be sweating, they may feel agitated. I've seen people get quite aggressive. I've seen people collapse as well. And you just have to try and manage it as the best you can. And I think drugs like benzodiazepines, like chlordiazepoxide, diazepam, are very effective in getting rid of the withdrawals too. So if someone is detoxing and so forth, but it has to be done under medical conditions. You have to make sure you work with the team, you're working with the doctor, you're working with the other nurses, and you have to plan the detox if that is happening. But if you're working in A&E as a mental health nurse and someone's withdrawing, then that could be a recommendation. But usually doctors will prescribe it just to help manage the withdrawal and effects and so forth. Okay, and alcohol poisoning. So confusion, vomiting, seizures, fits, slow breathing, pale or bluish skin, cold and clammy. Ring an ambulance if someone is presenting with these effects or unconscious and so forth. Try not to let someone sleep it off. That's probably the worst thing you could do for someone that's alcohol dependent. You want to make sure that they aren't they haven't been poisoned and so forth. And also there's a risk of people choking their vomit too, which is also another massive risk too. Okay, and levels of alcohol do increase if someone is sleeping as well, so bear that in mind. And I put on here something very common that's in drugs and alcohol, called the transferential model of behavioral change, which is from Petrasca and De Clemente. So it's quite an old model, but I would also always look at it from in terms of looking at the contemplation phase, so pre-contemplation first. So maybe someone is looking to stop drinking alcohol, and then they're contemplating. They may think, actually, it might be beneficial if I stop doing this, so I won't get in trouble with the law, or maybe I won't keep having accidents, falling down the stairs, or having arguments in the family. And then people typically, if they really want to do it and they've gone past the contemplation phase mentally, then they might want to prepare for the next phase in terms of, what do I need to be doing once I've started to detox, once I've done this after. Then there's the action phase where someone actually completes the detox or is carrying out the detox, and they're going through the withdrawals. They start to do group work, which is quite beneficial. Someone might want to have one-to-one counselling with a counsellor, or psychology, or with one of the key workers, drug workers working in the organisation, rehabilitation unit, or whichever unit someone's going into detox, or even in the hospital. And there's the maintenance phase, so keeping clean, keeping dry. If someone is drinking, or if they've just stopped using drugs, what's that person going to do? With the absence of not using drugs, or they're not drinking every day. What's going to replace that? So there needs to be some incentive. There needs to be some pre-planning before you actually send someone into detox, or make some massive change in someone's life. There may have been some abuse, for instance, that someone subconsciously buried and didn't really think much about, and hence why they're drinking so much. So maybe they want to deal with that, or bereavement, or it could be an accident, it could be a divorce, it could be many different things that could cause a breakdown, and why people drink or take certain types of drugs. So that's about the relapse phase here. So what do you do if there is a risk of relapse? Where will you go? Which group will you go? Will you go to NA, CA, AA? So there's lots of different options that you could undertake to get someone, and that's the cycle of change, to try and keep that going. And there is always the risk that if they have been taking drugs, or they are drinking too much, more than the norm, then that is always going to be a risk, and there's always going to be there. And sometimes people have to go around that circle a few times just to try and get that right. But I think it's also important to bear in mind recovery as well, because it's their journey. Their journey is different. Their journey is their own journey, and people are very unique. Not everyone has the same experience. Not everyone's in the same boat. Not everyone's been homeless and so forth. So individually, that person needs to make the choice for themselves, and that needs to be respected too, rather than from a medical point of view as well. So keeping in mind change, recovery, and assisting someone in their own personal journey, because it is their personal journey at the end of the day. If they want to give up drinking, they will give up drinking. Don't try and persuade someone to give up drinking. If they want to do it, let them do it, but obviously give the right advice, support, guidance, and that usually helps. Okay, and thank you very much. Nice to meet you on the screen, and I'm sure my parents will help answer any questions. But you can contact me at david.solomon@beds.ac.uk, which is my work address, or at Anglia at david.solomon@pgr@anglia student.anglia.ac.uk. So my student 1 too. Okay, thank you. Goodbye.